what the government is proposing today is that as long as it is no longer their business, as long as their citizen assume that risk when he suffers, we should leave them in the lurch no matter what kind of injury they have suffered. And we opposition has said that no matter who, because they are public, because they are citizens of America, they should not be denied the healthcare system, which is public healthcare system. And we see, let me cite you an example of hamburgers, which is the national food and versus heart diseases. So when they eat hamburgers, didn't they voluntarily assume that there is a risk of heart diseases? But why is the government still paying for the heart diseases causing in status quo today, sir? And we see that, and the government proposed that there's a less guarantee of safety. And they say that the taxes are not proportional, and they say that, and they see that the rich has their own capacity to pay. And what we say, let me tackle what the rich has enough capacity.
Fine, sir.
No, sir. Then can we say that that risk, that sport, the high risk sport isn't played just by the rich? No, sir. And we see that just because they are rich, the social status does not determine how the policy should be run. We do not see that just because that they are rich, they should be denied public health care. What in status quo, we are already giving them an avenue to actually private health care, sir. And we see nothing wrong with status quo, Mr. Speaker. And they say that taxes are not proportional. Like they say, the rich people are engaging. That's their own assumption. Then we say that doesn't the rich contribute more taxes? And shouldn't they actually be one actually paying for their own? And we all, no, sir. And they say that it's not proportional. Then let me give you another example of the poor in America. They do not actually contribute that much to taxes. And why is the government still giving them welfare? Government. And I wish to go to my point of deterrence in unnecessary deterrence for sports. We see that diving, we see that diving and skydiving actually brings out potential in government service, in the army, in the navy, where commandos are required to dive. And we see that by denying them, they no longer have the privilege or the interest. Because we clamp down their interest, we say that no matter what happens to you, we do not care. Yes, sir?
In the army service, this is for the country, it's not for your own interest. And you say that this does not apply to
what I'm saying is that because of they having this interest, they actually move on to the army. So, they have, whoever who participates in this high-risk sport needs to have a license, and that's a safety net which everyone should have. And accidents, and whenever injuries happen, there are accidents. No one wants to have to be hurt by any accidents. And we say that no, sir. We say that it's an unnecessary deterrence because you see, it clamps down the interest, and we see that there's no room for growth in this kind of sports like F1, like road, where it actually gives the nation a recognition, like perhaps hitting the top of Mount Everest, even though it's an extreme sport. But when we accomplish this, it actually gives the nation a recognition. No, sir. And I also wish to talk about an extra punishment, just for something which does not justify their wrongdoing, because they have not committed any wrongdoing, Mr. Speaker. You see, if we go with the government's policy, we are saying that it is wrong for them to do it. It is a punishment as a result of them engaging in high-risk sport. But I also like to say that the government has not actually explained to us that if the risk taker who is labelled the risk taker actually gets hurt on the street, like sprained ankle, do we actually say that we deny them entire public health service even though it's out of their scope of high risk?
You really say that they will sign indemnity form before taking the sport, not on the street itself?
Sir, we say that indemnity form is a voluntary assumption of risk. You see, where the government, so we are actually saying that indemnity forms are a protection to the people because of accidents which happen, and accidents are caused by human negligence. And I see that because of the other party wants to protect themselves for any compensation, and that is why they are actually forced to sign indemnity form, Mr. Speaker. And it is an extra punishment, you see. If they couldn't afford to bear medical bills themselves, like private healthcare, which is so expensive in America, and this has been, and this has been evident, and that do we say that we leave them in the lurch to die? And are we going to say that we do not give those people, an avenue to actually to get cured, and even they have actually contributed to society, as evident in my first speaker point, as participation in this sport does not make them any less citizen, Mr. Speaker. And they have said that it is the rich people, and especially the rich people, have contributed so much to society. And how can we actually deny them that right, that basic right of healthcare in America? And we should they say that we should not force them to take up private healthcare just because they are rich, Mr. Speaker. And I also like to further my yes sir.
We say that the rich already have private healthcare, so we say that.
What? Okay, sir. You are saying that we are forcing them to actually take up private healthcare by denying them private healthcare. Don't you? Isn't that your policy? Isn't that your policy to force them into private healthcare? And what we are saying is that we leave them that avenue to take up public healthcare if they want to, just because they are rich. We deny them. No way. They say that that's not going to happen. And it is. Let me further my point on being an extra punishment which does not justify at all. And we see that this kind of punishment actually, let me cite you an example of prisoners who they are actually being punished, and they are still getting healthcare in prisons. And we also see that this extra punishment is an extra punishment for something which does not justify, because they voluntarily assume that risk. And why are we actually imposing this punishment to them? And because of denial of basic rights of healthcare to the American citizens, this motion